But tonight, CBS2 investigates. A COVID testing lab that got millions of dollars of taxpayer money has been operating without authorization in California. And federal investigators say the lab's test results could be flawed. Investigative reporter David Goldstein is breaking this story tonight. David?
Well, Pat, more than 180,000 people in LA County alone use this one lab. Now, many people have been flooding COVID test sites, but really don't know who's doing the testing. We found one lab that state and federal officials are investigating, and some people who got their test results say they knew something just wasn't right.
It makes me angry, I'll be honest.
Steve Norberg, his wife and 3 daughters got tested for COVID, and the results were far from clear.
Was she negative or was she positive?
That's a very good question.
The Norbergs went to a testing site in Long Beach where 19-year-old Stephanie got a rapid test that came back negative. They then opted for a PCR test that was sent to North Shore Clinical Laboratory in Chicago. Stephanie got this email 10 days later from North Shore showing she now tested positive. But 5 days later, North Shore sent another email. She's really negative, based on the very same sample.
What was going through her mind, your mind, when you get all these different results?
A lot of frustration and questions about the testing center, whether it's legit, whether they're doing it right.
North Shore has labs in Chicago and Ohio and contracted with pop-up COVID testing sites around the country. The labs are licensed by the federal government to do COVID testing, but not licensed to process PCR tests from samples in California, according to the California Department of Public Health. They confirm North Shore is under investigation. Even so, the LA County Department of Public Health says North Shore processed more than 183,000 COVID tests in the county so far.
That's alarming to me.
We also found federal inspectors cited the lab for what's called immediate jeopardy, the highest level of infraction.
How serious is immediate jeopardy?
Immediate jeopardy means that patients could be harmed by the practices that are happening at that laboratory.
Dr. Omai Garner is director of point-of-care testing at UCLA. We showed him the December 2021 inspection of North Shore by the Centers for Medicare and Medicaid Services, all 29 pages.
To be honest with you, I've never seen a laboratory that had this many violations.
Inspectors found North Shore failed to follow the manufacturer's instructions on COVID tests. That had the potential to affect all patient COVID testing. Plus, North Shore failed to ensure confidentiality of patient information. And finally, a lab director, according to the feds, didn't meet federal requirements.
Anybody who had ever sent anything to this laboratory specifically needs to be very concerned that the results that they got back were accurate.
And that's a lot of people. According to the CMS inspection, North Shore has conducted 5 million tests nationwide in 2021. And data we obtained from the CDC shows North Shore has taken in $150 million in taxpayer money nationwide from the feds. That doesn't include any money billed to private insurance companies. A spokesman for North Shore Labs responded by saying they've retained the nation's leading laboratory consultancy to help support processes, procedures, and technology to better improve their lab services. They say the lab director was replaced, and they claim they are allowed to send tests to their labs outside the state. But the California Department of Public Health says their license, which was only granted in January, only allows them to do in-person rapid testing at a location in Northern California, not PCR tests. And some testing sites are taking notice. Guardian Testing, which has COVID sites at many LA County Sheriff's Department stations, says on their website they no longer use North Shore as their processing lab.
How does something like this happen?
It's absolutely outrageous.
Jerry Flanagan is with Consumer Watchdog, a consumer advocacy group. He says the state needs to regulate testing sites to make sure this doesn't happen.
If you're operating in California as a testing site, we need to know where you're sending this stuff. You cannot send it to these sites that we know are violating federal law. This is exactly the kind of thing we want to make sure doesn't happen.
Well, North Shore says they're no longer doing testing for pop-up sites, and they are working to improve the conditions in their lab, working with the feds to try to get that done. So, Pat, right now it seems that they're not doing testing in California, at least for now, but more than 100,000 tests in LA County alone.
Already. That's really amazing. An eye-opener for sure, David. Thanks for that.
Okay, thanks.
Well, do you have a CBS2 tip for David Goldstein? Just call 818-655-2442 or email us at CBS2Investigates@cbs.com.